Hi, I'm Dr. Gerald Deas. Welcome to Health Center from Downstate Medical Center. We're going to continue a conversation on a very important environmental element called mercury. What is it? How do you get a hold of it yourself in foods or in water or different contaminations as such? But mercury is a neurological problem. It really affects the brain, you know, and when you go into areas where mercury is being used in paints and all other things, even certain, they used to use it in just filling of teeth and things like that with other metals and things like this. It's a hidden disease. It has not been investigated. It's been investigated enough, but not enough to look like politics or anything who wants to get involved in it to change the where this substance is coming from and how it's affecting a population of people, particularly in poor areas. So we have Dr. Arnold Windroff here from Brooklyn College, who has traveled the world over dealing with all kinds of parasitic diseases, bacterial disease, viral, but mainly metals, toxic metals. So I hope that you, after hearing what he has to say, can relate this to our politicians and the people who control the food industry and things like this, that they should be checking out people out for mercury as well as they do other things like lead and things like this. So I want to welcome Dr. Windroff.
Thanks very much for having me again, Dr. Deas.
To be with us today, yes. Dr. Windroff, I know we left off talking about seafood and mercury in seafood and how it gets even into that. But in continuing now, could you give us a little more of the political aspect of this mercury intoxication?
Yes, indeed. You alluded to just now mercury and paint. And by an odd coincidence, the day of publication of my initial letter on this in the journal Nature, the very same day, Wednesday, October 18th, I believe it was, 1990, there was a lead editorial and a major research article in the New England Journal of Medicine having to do with several cases of acute mercury toxicity from mercury vapor that was emanating from paint. And the source, by another weird coincidence, the source of this mercury in paint was from the Mercury Paint Company here in Brooklyn, New York.
Oh, wow.
The Mercury Paint Company was making latex paint, interior paint,
yes.
And interior latex paint can be attacked by fungus
Right.
in the can.
Right,
because
yes.
it's wet.
Yes.
So they add a fungicide to it, and they were using phenylmercuric acetate, an organic mercury compound.
Isn't that interesting?
And there were numbers of cases of babies being poisoned. They didn't know what it was. They found that they were being poisoned by mercury. They had no clue. And finally someone realized it was the phenylmercuric acetate on the walls of the homes that was being degraded by light, I think,
Yes.
and air, and releasing mercury vapor. So there was a great deal of concern, and there was legislation passed in short order to prohibit the use of mercury fungicides in interior latex paint. The very same day I published my initial article or letter on this ritualistic use of mercury, where people in some Caribbean Latino communities believe mercury attracts good and repels evil. They buy the mercury from their little folk medical stores, botanicas, and they sprinkle the mercury on the floor. Now, obviously, this is a relatively small population compared to the universe of people who are painting their homes with latex paint.
Yes.
But the amount of mercury, the exposure, the levels of mercury vapor are much, much higher. There was legislation passed in short order to prohibit the sales of mercury fungicides in paint. There was nothing done in a political line to either investigate or to regulate the sales of mercury by the botanicas. So I was working as a teacher at the time, as I had mentioned in your previous program, and I was working on my own as an advocate. So I put this to manifold health agencies and politicians with regulatory authority over the health agencies. And that was beginning in 1990, and still today we have had largely lip service but no action. And this in part is due to, well, there are several factors. One is the innate political incorrectness of the issue, where we have poor people in minority communities and sort of minority religions who are using this mercury in a religious manner. We have no way to legally identify the source of the mercury contamination, and thence there's no way to make the polluter pay. The cleanup of this is extremely expensive. It's going to fall to government should it materialize. And assuming that you could make the polluter or you could identify the polluter, these are generally poor people and they don't have the money at several tens of thousands of dollars per home, so that cost again falls to government. And thirdly, there's been a great deal of antipathy and embarrassment on the part of the educated elites of these communities that are impacted to acknowledge that there's a problem and to do any advocacy to have it addressed. And in fact, there's been a lot of negative advocacy to basically suppress this. So I have a number of letters here. I'll refer to some of them, but we have a bunch of correspondence from then. He was known as Charles Schumer, Representative Charles Schumer. Today he is Senator Chuck Schumer. So back in 1994, 97, etc., then Charles Schumer was writing to the New York City Department of Health, the health commissioner, requesting some assistance in getting them to do something. And he followed up with a few more letters, but nothing was done. And then latterly, when I resurrected this with his office in Washington just this past year, his office people wrote to me to the effect that there was no one who was interested in this, and that there was a lot of bureaucratic red tape and no one was doing anything.
Now, in getting in touch with Schumer, what would be his follow-up on something like this? I mean, you got letters from them saying they're not interested, but isn't his in the position that he's in, should be able to forward this to Food and Drug?
Well, he has a bully pulpit. He has been involved and interested in numerous environmental health issues. Earlier this year, he was in the papers and was doing a lot of advocacy having to do with algae blooms in some of the lakes in upstate New York. Algae is toxic stuff in the water, but again, no one has to be swimming or drinking that water. But when I put that very issue to his office, no one wanted to know. We have a similar phenomenon with Representative Nydia Velázquez, who's by birth Puerto Rican, was intimately familiar with the issue because I had briefed her and her staff on it, and held a hearing after some unflattering articles about this appeared in El Diario La Prensa in 2001, I think it was. And she held a hearing in her offices and basically attacked me as being a racist and was in total denial. And she wrote some letters again to try to get something done, but there was no follow-up. In fact, she wrote to Representative Henry Waxman, who's a big environmental advocate, and if there was any response from him, it was never implemented. I have a letter here apropos of politics and public health from then Surgeon General Antonia Novello, who was the Surgeon General of the United States, and she later became the health commissioner for New York State. This is October 16, 1990. Dear Dr. Wendroff, we received your letter in which you expressed concern about the risk of domestic mercury vapor exposure. The ritual of sprinkling mercury on the floor to ward off evil spirits is practiced by selected minority groups and may pose potential hazards to those who encounter the mercury. Now, there's nothing may and nothing potential. And then she winds up here that she's confident that the Centers for Disease Control and their Agency for Toxic Substances will remain vigilant in the pursuit of this potential health threat. Well, again, they have not been vigilant. And I just wrote a letter to the brand new Surgeon General, Dr. Murthy, and although I sent it by certified mail to him on December 16th, I think, and it was delivered December 22nd, no one claims to have any knowledge of its whereabouts, and hence I sent it by email to the assistant, Dr. Gentleman whose name eludes me at this juncture. So he received it by email with its attendant attachments, but has failed to get back to me on it. And just illustrative of the politics again, this was a brochure download from the internet of the New York City Healthy Homes Summit that was held here in the city November 21st and 22nd of last year. And there are about a dozen odd people here, some in government, some not, who were fully aware of this issue. I was not invited, and the governmental people include the current chair of the City Council's Health Committee, Corey Johnson, Daniel Cass, who's the head of environmental health for the health department, the Honorable Gail Brewer, who is now the Manhattan Borough president and whom I met when she was a councilwoman, and who wrote to the health commissioner on this issue, did no follow-up. Honorable Letitia James, currently the public advocate, tremendous amount of data fed to her offices, nothing doing. And let's see, Nancy Jeffrey, who's with the Health Department, Environmental, and City Council woman Rosie Mendez. So these are all among many government officials who were intimately familiar with the issue and have refused to address it. Now, getting back to the City Department of Health, this is a letter written by then Health Commissioner Neil Cohn, January 2000. And he is sending to allegedly several thousand primary care physicians. He is sending a packet of these brochures to these family practitioners, OBGYNs, and who are the others? Pediatricians. Dear colleague, enclosed is a brochure developed by the New York City Department of Health describing a route of exposure to metallic mercury that may affect some of your patients. It has been reported that in some Latin American and Caribbean communities in the city, metallic mercury available in botanicals and religious stores is used in religious or ethnomedical practices in a manner that may adversely affect health. And I'll read one more paragraph. Sure. The type of damage to the body caused by this form of mercury is dependent on how much and for how long a person is exposed to it. Mercury vapors can persist in indoor environments for long periods of time, and because the vapors are invisible, people who live in or regularly visit homes where mercury is used may not be aware that they are being exposed. Unfortunately, metallic mercury has the greatest effect on the developing central nervous systems of fetuses and young children. Right. So the health department had been very much aware of it, had participated in EPA Superfund's ritualistic uses of mercury task force, had produced these brochures, had never disseminated them in any meaningful way, had withdrawn them. They had them up on their website, and they've withdrawn them from the website, so there's no knowledge. And the clinical community is essentially remaining unaware of this.
Well, I'll tell you, when I was working with Argo starch, and the eating of laundry starch by African American women, I had the same problem until I got to media. Once I got to media, the Mercury report I did for 10 straight years from 87 to 97, shot over 1,000 shows there. Even then, there was no black physicians ever on television doing health work. Believe it or not, and this was Channel 5 for all these 10 years. And now you see very few of us there even now. Unless you can get to the media. Media shakes them up a bit. It starts letting the public know and demanding more. And unless we can do that, and it's very hard for you to go into any of these studios and say, I have a story. Their stories are all connected with products that they're producing that have an effect upon their income.
There are two parts to this, and you're right and yet you're wrong. Mm-hmm. The media, this is a sexy issue.
Right.
The media have picked it up. It's been several articles, 2 articles in the New York Times. The New York Post has had a couple of articles, the Daily News. El Diario La Prensa, the major Spanish language media outlet, until fairly recently, has had, I believe, 8 stories. In 97, in 99, and in 2001, 6 stories in about 2 weeks, which is what prompted Nydia Velasquez to contact me and hold a hearing. However, they have been entirely, utterly ignored by both the affected public and the larger public. And the reason why is that, as I understand it, the bottom line here is, do we have evidence that it's a problem? Do we have scientific evidence that we have homes that are contaminated from this source and that we have people that are contaminated from this source? In 1999, the CDC's Agency for Toxic Substances stated in writing that these are their words, there is an urgent need, quote unquote. In March of 99, there was an urgent need to measure mercury vapor in a representative sample of this Caribbean housing, especially in the winter with the heat on and the windows closed. No one has wanted to do it because it was obvious by then that if you did it, you would find people damaged by it, you would have an enormous and very expensive problem.
Yes.
That remains the case virtually today. There have been a couple of studies in New Jersey of measuring mercury vapor in heavily Caribbean housing in Union City and West New York, contiguous towns, but they did it in the summer and they did it in public hallways. They found the mercury vapor emanating from apartments. No one wanted to knock on doors. Now, a few years ago in Rhode Island, there was a case that would appear to be what we say in the trade, an index case of a family of 5, a Puerto Rican, ethnically Puerto Rican family. They moved into a new Section 8 apartment, carpeted apartment. Their 3-year-old girl started getting mysteriously ill. She was in and out of the local clinic, seen by a resident who ultimately couldn't diagnose it, referred her to Hasbro Children's Hospital of Alpert Medical School, Brown University. So we're talking high end. The chief of pediatrics, who was on the ball, Brian Alverson, he noticed that this little girl's fingers and toes were all red, peeling off. She had a lot of heart and kidney involvement. Classic signs of an acute form of very rare mercury poisoning, acrodynia. He ordered that the mercury be measured in her urine, the notifiable level being 20 micrograms per liter. This little girl, I think, was something like 36 or 60. I forget exactly what. This got into the news. I followed up. I apprised them of these possible exposures. Because this is a notifiable disease, if you have 20 or more micrograms per liter in your urine, the local health and environmental departments are mandated to ascertain the source. They immediately went to this child's home, where the evacuation level being 10 micrograms per cubic meter, it ranged from 14 in the vestibule to something like 36 in the apartment, the vacuum cleaner 90. Wow. It transpired that the prior occupant, who had left in late November, the family moved in December, was a Dominican woman who the neighbor said practiced various rituals on her bedroom altar, which is where they found droplets of mercury. So they followed up and they went to her new apartment, where she'd been living for only a couple of months. And whereas the level of mercury vapor should have been under 1 microgram per cubic meter, it was over 5. Wow. She claimed she had broken a thermometer. None of the 3 state and commercial environmental professionals believed that. Now, political. The Rhode Island Department of Health and the Rhode Island Department of Environmental Management investigated this. And it was written up by Brown Medical School people in the journal Pediatric Dermatology, with wonderful color photos of this kid's hands and feet, and then later in Pediatric Emergency Care. Even if you aren't a physician, if you know, if our friend over there knows, that you have a kid or any person poisoned from an environmental contaminant in a home, in the context of a family, the first thing that you're going to do, and the first thing you're going to inform your readers to do, is to check out all of the other occupants of that household.
Of course.
They didn't mention that in their 2 articles written for people like you who are primary care, who are physicians. And even more interestingly, the 8-year-old sister, the 10-year-old brother, the 32-year-old mother, the father was never tested, he didn't have insurance. When they were tested, their urine mercury levels were all way above the reportable level. And all 3 of them were prescribed chelating agents to remove their surplus mercury. This was never mentioned in these 2 refereed journal papers. My contention has been, and those of others, that of others, there is a latent epidemic of mercury poisoning occurring right here in our heavily Caribbean community surrounding Downstate. And it was demonstrated by this family where one kid was acutely poisoned, but the others appeared to be normal, and yet they had this very high mercury levels in them, but they were asymptomatic, as most kids are asymptomatic today who were lead poisoned. And we picked them up because of routine blood lead surveillance. The families and clinicians know about it. So here it would appear as if the state apparently intervened, put some political pressure on the people at Brown, because I had put it to the editor-in-chief of the Morbidity and Mortality Weekly Report. And I sent him all of this information, and he emailed me back stating this would be just what we would like to publish, and yet they never published it.
Sure. Well, I tell you, prior to coming to medical school, after Brooklyn College and serving in the service and during the Korean conflict and getting a master's in biochemistry, then another master's in public health from the University of Michigan, and then studying the toxicology environment of Detroit, which is a great automobile thing, and measuring all the toxic material that they produce and so forth. My interest in being not director, but being on this program or carrying this program out of Downstate Medical Center, I can at least open it up to get the real stuff that's going on behind the scene. It's all right to have you say all you said, but it's important that other media should be doing the same thing, where this is a Downstate, but I'm talking about CBS and NBC.
I'd like to drop the name of our current mayor, Bill de Blasio, who was informed of this many years ago when he was my city councilman, again in even more detail when he was the public advocate, and he's abjectly done nothing. And his successor, Letitia James, is in exactly the same boat. I've gone down there several times, I've fed them all this information. They don't want to do anything. And ditto our current and former chairs of the Health Committee, the Environment Committee, the Buildings and Housing Committee. They don't want to know about anything of this nature. They don't want to push the Health Department, the Environmental Protection Department, the Building Department, NYCHA. NYCHA buildings are certain to be laced with this. EPA Administrator Judith Enck wrote to me in 2010 urging me to apply for a grant to measure mercury vapor in housing, specifically NYCHA housing. It was put to NYCHA, and NYCHA refused to do anything.
Well, why can't we have a conference on this and make it a major conference from the Board of Health?
I've suggested that on many an occasion. No one wants to do that. As I showed earlier, we had this conference on healthy housing in November of last year, and not only was I not invited, that was neither here nor there, but they refused to address the issue at all, and this was funded by an EPA, New York City Department of Health, etc. They funded this, they know about it, and they don't want to know about it.
Well, I think that this right here, Downstate, because we're right smack in the middle of the community, appreciate your work that you've been doing. And I certainly have been, because this is not the first interview I've done with you. We've gone along for many years to bring this to the public and bring it to the political people.
I guess I ought to mention, I don't know how many minutes we have left, but Downstate here public health school did 2 papers on this. They did a study where they specifically were doing the study because they were aware of this issue. They were concerned about the possible sequelae of mercury exposure in housing from this source. And ultimately, when they measured the mercury in the urines of about 180 pregnant women and then later measured mercury in their cord bloods as they gave birth, they attributed all of the surplus mercury to their fish eating rather than to any possibility of secondhand exposure from their homes. And although the original protocol that they wrote up stated that they were to measure the mercury vapor in the homes if they found elevated levels in these women, they never did it.
Are you planning now to measure some of these vapors?
We're on the verge. I'm not holding my breath, but I am crossing my fingers. I have a colleague in the Bronx, a nurse educator. She is, as we speak, collecting a cohort of Caribbean people up in the Bronx that she knows. I have the instrument to measure the mercury, and possibly as early as this weekend, we're going to be going into housing. If it comes off,
right,
and measuring it in people's homes in the winter with the heat on and in the public hallways of these apartment buildings, so we get a bigger picture of what's going on. If it happens, you will certainly be apprised, but it will be, if we find it, it will be a big deal.
Well, let me put it this way. I don't think this will be the end of my interest in mercury, and so certainly we would like to follow this right on through till it reaches the head folks in Washington. That a major study should be done now. And never mind what the real estate, it costs the real estate to demercurize the housing. But I mean, it's one thing to bring to the public this terrible situation, but at the same time, it's up to the government to protect its people from this senseless poison that's in the air and how we're getting it.
The government has been and remains derelict on this issue.
Well, I tell you, we have just about 1 minute because in closing, what would you say?
Well, if anyone who listens to this and wants to get and has a suspicion that their home might be contaminated, then it's easy enough to go to your clinician and ask that a urine mercury be done on you or your children, right, and that will give you some idea of what's going on. Mm-hmm. And then you could have your home tested. Or if you have more suspicion that it's contaminated, call up the Department of Health and ask them to come in and measure the mercury vapor in your apartment.
Right. Well, I think that you've done a wonderful work.
Well, thank you very much for inviting me.
And I know this is not the end because you've done so much in other countries and so forth. So you folks out there, it's up to you. Just don't look at a program and say, ho hum, that doesn't involve me. It involves you, it involves your children, it involves your unborn children. Take advantage of all the information that you hear from Downstate Medical Center. We're located right here, right in Brooklyn, right across from Kings County Hospital. And I've been here since 1958 as a student and as an instructor and so forth. So we hope we can continue this type of programming for you. We'll see you the next time.